this year, more than ever, there's greater talk of brands having a purpose, the need for our working creativity to have a purpose, to have an impact on humanity and society, and about brands needing to be able to have a return on doing good and not just a return on investment. And I think what we've seen from the health and wellness track this year is just how there's huge potential, probably more than any other kind of category, for us to be able to kind of bring those things to life and to have an impact and make a difference to people's lives.
It's been such an inspiration. I've been judging on the health and wellness jury. An amazing experience, and the whole thing basically was takeout was brands with a purpose, inclusivity, democratizing design. It's all about uncovering humanitarian crises and how health and brands can actually fit into that and make a difference. Health and wellness was much more a broader sense, more humanitarian, was uncovering situations you actually didn't even know about. And brands that are getting involved that you didn't think brands would be involved in health. IKEA, for instance, won the Grand Prix. And
what a beautiful piece of work. I was so impressed.
Yeah.
And then as well, the nature of diversity and getting people that are most of the time marginalized just because of a condition, you have a disabled person, of being able to have furniture that is good for them.
Yeah, exactly.
So IKEA really pushing the boundaries and getting disabled people to have better lives, right?
It's really showing us that brand health means something to brand. And it felt quite good for IKEA to do that. It didn't seem out of place for IKEA to do that. I think we've got to be careful that brands don't just suddenly hop onto health for the sake of it. They've really got to think about their own core values and their position in the world. Johnson & Johnson supported a documentary on the nurses an AIDS ward, first actual AIDS ward in San Francisco, and it was a beautiful documentary. It showed the bravery of both the people and the nurses, and it was just a nice little subtle thing at the end. Johnson & Johnson came on, so I want to sort of get our pharma brands to say, hey guys, what can we do there? How can we help humanity apart from what we're creating? And really kind of like
they're already doing amazing drugs, right? And they're really helping in that area. That's a story to tell. It has to be out there. It's a bit shy at this moment, right? I think people still need to go get out there and tell more about it.
Yeah, exactly.
That's the message we should get, right?
That's it.
Submit, do more work.
Yeah, just make it great. Have a purpose.
Have a purpose.
Have a purpose.